Assalamualaikum. In this video, I am discussing a recall communications that is lots of time come 2018, 19, 2022. That is developmental dysplasia of hip or DDH. And the task is that you are talking to the mother of an 8-month-old baby who has a family history of hip dislocations. His checks were normal at birth and 8 weeks. The mother noticed that the child's lower limb was not moving correctly and shorter than the other limb. X-ray of the hip showed that features of hip dislocation DDH. So here that is one. Another is talk to the angry mother about the X-ray findings and the limitation of the screening for hip dislocations. So here mother is so angry. So first of all we draw the picture and IRCAP, we know that. The explanations. Normally our hips is forming of two bones, hip bone and the thigh bone. They are forming what we are called ball and socket, where the socket is the hip bone and the ball is the head of the thigh bone. Normally the socket is deep enough to contain and maintain the thigh bone in its place. It becomes loose valve, this easily dislocatable. We will have an urgent meeting with our consultant and bone doctor because it will need a surgery. So first of all we tell the normal anatomy. Normally our hip is going through the hip bone and a thigh bone. Hip bone ball and socket type. The socket is the hip bone and the ball is the head of the thigh bone. We draw the pictures and marking that. Normally the hip bone is enough deep that it can contain and maintain this head with attach, but sometimes dislocation occur. So this is happened. One is normal picture, one is dislocatable picture we draw, and that's why we need to talk with the urgent meeting with the bone doctor because the treatment is surgery. That mother is angry. Why is not discovered early? Actually we are doing a clinical screening test usually at the 3rd day and 6 to 8 weeks. We are searching for these conditions and whether it has a clicky hip or not. But RIA has not the click. First of all, we DDH routinely check at 3rd day of life and the 6 and 8 weeks. And when we check, we find is there any positive clicky findings or not. If clicky finding present, then we do next step. But RIA has normal finding, no any click we find. Also, it called developmental. Also, it may take some time to develop. That's why we did not discover it at birth. So sometimes it develop later and with time because of development. That's why you cannot discover it early. Then why you did not do jelly scan at birth? Mother is asking. Normally we are not offering jelly scan to all babies. We offering the babies with clicky hips or if there is a family history of the same conditions or presented with his bottom or one of twins, but Ria was the second baby and coming with his head and without any family history. So mother is telling why we have not do the ultrasound at birth because we have not offered everyone ultrasound at birth. If there is any risk factor like fast birth, bottom come, family history, and also is there any click find, then we do. Mother telling my sister has the same conditions. I am sorry for you sister, but this is not a first degree. Family history to be considered here is a sister or brother, father or mother. So family history means father, mother, sister, brother. Auntie is not the first degree. If I have another baby, will you do a jelly scan for him? Sure, because here he will have a family history of the same conditions. She will complain, try to convince her, then it's totally your right. I will guide you through pulse, patient advice and liaison service as usual. And after that we summarize trusted website, leaflet. This is all about DDH communication. Thank you.